Dear friends, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani, and with us is today Dr. Samir Khalil, who is a psychiatrist at St. Joseph Healthcare Group, Mental and Addictive Health Services. Today we are going to talk about substance abuse. Substance abuse is a pandemic disease all over the globe. Millions of people are affected with the substance abuse or drug abuse, and it costs millions of dollars to many countries. Not only in the terms of dollars, but it has also effect on the personal health, criminal system, legal system, and overall society at large is affected with the substance abuse. So today Dr. Khalil is going to guide us about what is substance abuse, what are the treatment options, and how can we help society at large to avoid this problem. Thank you, Dr. Khalil, for coming to the show Talk with Your Doc.
Thank you so much for inviting me.
Please tell us about what is drug addiction or substance abuse.
Well, thank you so much for the invitation. It's a pleasure to be here. I totally agree with you. It's a very important topic, and I'm pleased that I'm here to discuss about it. In order to understand drug addiction, we need to learn a little bit more about the difference between drug addiction and drug dependency.
Yes.
These two terms are used interchangeably by many experts as being the same, but I think we need to learn a little bit more to tell the difference between both conditions. Drug dependency is more of a state of psychological and physical reliance on the substance. For example, when someone uses drugs on a regular basis, what that would lead to is a state of tolerance where the individual will require higher and higher amount of the same substance in order to achieve the same result or the same outcome.
So that is drug dependence.
That's drug dependence. It can also be associated with cravings, strong cravings to use the drug again and again, which prompts relapse frequently, which makes the condition more challenging to treat, but can also be associated with inability to cut down or control the use of these illicit substances. And what that can result into is that the individual will neglect major role obligations, whether it's occupational, their careers, their relationships, or their day-to-day activities. And there will also be a state of physical dependency, which can result in withdrawal symptoms. If the substance is suddenly stopped or discontinued, that could lead to withdrawal effect.
So that's in substance dependence.
That's in substance dependence.
So what is addiction then?
Well, according to the World Health Organization, addiction and dependency share the same features as I have described: the cravings, the increased tolerance, the physical and psychological reliance, and the inability to control. But at the same time, drug addiction is associated strongly with destructive behavior, which can be destructive to the society and to the individual. And that's why drug addiction can be associated with increased rates of crime, increased rates of infections, legal consequences, as well as health and physical health problems.
So you mentioned that when drug dependence leads to criminal or destructive activity, is that the drug addiction then?
That's correct, yes.
Okay. So what is the transition from drug dependence to drug addiction?
Well, there's very strong link, and they are very closely associated together. And it's very important to realize that when an individual suffers from drug dependency, there is always a very high tendency to engage in destructive activity, like I have mentioned.
Okay. So now, why is the person keeps on using the same substance or same drugs again and again in terms of substance dependence or drug abuse or addiction?
While the exact reasons why drug addiction is developed in an individual is not known, there have been many theories about several factors that could lead to drug addiction. For example, there are genetic factors, social factors, or psychological factors, and environmental factors. So for the genetic factors, there have been many family studies that show that family members who tend to have addiction problem, their relatives are more likely to have addiction issues.
Okay.
Twin studies, if one part of the twins have addiction problem, that almost contributes to half of the increased risk of developing addiction problem. With regards to psychological factors, there have been numerous studies which have shown that drug addiction is strongly associated with history of trauma, especially at young age. If there have been situations where there's history of neglect, chaos at home, strong peer pressure, or any abuse, sexual, physical, or emotional, that can lead to later on in life increased risk of addiction.
Okay. Now, so somebody may say that, okay, I am going to use drugs or alcohol only once in a while. Can that lead to drug addiction?
It is not necessarily the case that one person would use a substance once, then that can lead to stimulation of the brain and that can lead to drug dependency or drug addiction. Many people would use the drug once in their lives and they never go back to use it again. However, some of the substances have very high addictive qualities.
Yes.
And that can open the window of vulnerability. So if they experience some pleasurable effect, if they experience the energizing effect, or if it leads to some boost of their self-confidence or their self-esteem, that can reinforce the internal reward system in the brain to encourage the individual to seek the same substance once and again and again. And these substances have very persistent and powerful effect that can rapidly develop into drug addiction.
So even somebody says once in a while is no good.
Absolutely.
Right. Now, what are the drugs which are addictive? Can you list some of them?
Well, there are many drugs that are addictive, and most of them have their own specific ways of causing drug addiction. However, there are some general kind of rules that apply to all of them that lead to the drug addiction. One of the most commonly used substances that can lead to drug addiction and dependency is alcohol.
Alcohol, yes, alcohol is very commonly used.
Absolutely, and many people use it legally, they use it regularly without any potential harmful effect, and they don't develop any problems with dependency. However, there is a proportion of people, small proportion of people, who use substantial amount of alcohol to generate some positive effect in themselves initially. What that can lead to over time is that they would try to seek more and more of the same amount of alcohol without realizing that they have they develop tolerance and they increase the amount of alcohol in order to generate the same effect. So in order to feel content, calm, relaxed, they try to use alcohol and they use more and more, and that kind of gets them into a vicious circle of dependency. So alcohol is one example.
Okay.
There are other examples. For example, there are the stimulants like methamphetamine, or the meth, or
marijuana.
Well, marijuana is something probably a different group.
Okay.
But there are some structurally similar substances like methamphetamine or the meth that have very high addictive quality that lead to the individual would struggle to cope without persistent use of the same effect. Similarly, can be said about heroin, or which can give some sense of pleasure or relaxation. You've mentioned about marijuana. Marijuana now is used widely.
Yes.
And there are many therapeutic purposes that have been identified.
Yes.
They use it for pain control and management, for example. And its use over the years have become more commonplace. But many people use it for pleasurable
recreational
purposes. Recreational purposes. And the active ingredient in marijuana is called THC. And what has been found in studies that it also has addictive quality.
Right.
So, for example, if someone uses marijuana just to get that effect of feeling content or giddy or relaxed or feel more calm, with time, that would lead to seeking more and more amount of the same substance to get the same effect. And if they kind of withdraw it or they try to stop it, then there will be some withdrawal symptoms,
Sure.
which kind of suggests that there is risk of dependency on marijuana as well.
Right. We'll take a short break and we'll continue with the discussion on marijuana.
Sure.
Please stay back for the next part of the show. Thank you. Welcome back to the show Talk with Your Doc. Today we are talking about substance abuse or drug addiction, and Dr. Samir Khalil is guiding us about the various principles of treatment for the drug addiction. So Dr. Khalil, you were mentioning about marijuana, and you were mentioning that it is one of the most addictive substance at this time available and is used even for therapeutic and recreational purpose.
That's correct. And as I have mentioned, there have been many studies that show that the active ingredient in marijuana, THC, has addictive qualities. And in order for the individual to retain the same pleasurable effect from using it initially, they have to use it persistently. And if they go without smoking pot for a few days, they would experience some withdrawal effect, like feeling depressed, feeling more anxious, feeling less motivated, which suggests again that there are kind of risks associated with the use of marijuana, especially recreationally.
Okay. So now if somebody gets addicted with the drugs or substance abuse, then what are the treatment options available?
Well, regardless of the substance being used, there are multiple treatment options available, and I will talk first in general terms, but then I will narrow down to what's available within the northwest of Ontario. For many people, they will benefit from being involved in outpatient settings or counseling services where they have access to a therapist who would discuss with them about shared objectives and goals in terms of management of the drug problem. And what that would mean that the individual probably would be part of a team, multidisciplinary team, which can involve counselors, psychologists, in order to manage the drug problem. And that can be done in the community on an outpatient basis, and that can involve counseling sessions, psychological treatments, cognitive behavioral therapy, or even medications.
Okay.
If it's more intense, if it's more serious problem, then there are addiction facilities, residential addiction facilities, which provide safe and secure placement for detoxification and rehabilitation for 24 hours for a limited period of time.
They're monitored there for 24 hours.
Absolutely.
Now, how long is this treatment for the drug addiction?
The treatment, it varies from one individual to the other and depends on so many factors. Depends on the willingness and the desire of the individual to engage with therapy and obviously the level of motivation. But it's also important that they are aware of the availability of help and assistance to and the resources that are...
So it can last anywhere between few days to few months?
Absolutely. Or it could be longer, and sometimes takes more than one trial. Sometimes people don't achieve the desired outcome or achieve all the goals with the first time. They can go back again and again. The door will always be open.
So sometimes patient who gets this treatment of counseling and medical treatment and in-house facility of treatment, but sometimes patient go back to the substance abuse thing again after the treatment is over. It's like a relapse thing.
Sure.
So how can people avoid that for a longer time after the treatment?
Well, it's important that people who are struggling with drug misuse problems are aware of the availability of support and access to resources within the region. And once they realize that it's an open door arrangement, they can return back, they will always be warm welcome. Yeah. That will encourage them to maintain therapeutic relationship and retain them into the service.
Right. Now, some patients, they drop from the treatment, like half the way in between. So how can we retain them in the treatment, or how do they stay in the treatment for a longer time?
Well, it's important to identify the reasons why they drop out of treatment. There are multiple reasons. Could be related to the individual himself, could be related to their circumstances, or it could be caused by other factors, like, for example, mental illnesses. If they suffer from coexisting mental disorder, that can make it more challenging and demanding. So addressing the mental health issues would be necessary. As I've mentioned, trauma can play a big factor in the relapse or in the development of drug problems. So the patients or the clients need to be reassured that once their drug problem is stabilized, there will be some further work to be done on trauma management.
Yes.
Other ways of ensuring continuous or an ongoing care is to support their families, friends and relatives, so that they have the more determination and commitment to address their drug problems.
Right. Now, can a person who is taking medicinal drugs can get addicted to that particular drug?
It depends on the drugs. Some of the pain relief medications are opioid based. They have similar addictive qualities. They also give similar sense of content and pleasure. I think it's very important that people are aware how to use these medications. Most of the time, like, for example, oxycodone is one of the medications that has the potential to lead to drug dependency. So for people who are on these medications, there are certain guidelines that they should follow. For example, they should take the medications as directed and as prescribed.
Okay.
They should be more aware about the potential risk of dependency, any potential risk of interaction with other regular medications, with over-the-counter medications. They should not reduce the dose or increase the dose without discussing with their doctor. They should not give the medication to other people or use other people's medications. And if they have any issues or concerns about drug dependency, they should discuss it with their doctors.
So prescription drugs are also addicting. They are not safe.
Well, there is a risk of addiction. They are safe if prescribed with close and regular monitoring by the specialist services. However, there is a risk of dependency that must be acknowledged and avoided.
Right. Thank you, Dr. Khalil. We'll take a short break and we'll continue with the last part of the program. Thank you. Thank you. Please stay back for the last part. Welcome back to the show Talk with Your Doc, and today we are talking about substance abuse. Dr. Samir Khalil is helping us to understand drug addiction problem and how to treat it. Dr. Khalil, you were mentioning about the treatment component of the drug addiction or substance abuse. Now, how can the workplace and criminal justice system help in the resolving this problem of drug addiction?
Well, certainly. There are many organizations who work in partnership with drug treatment facilities, and I am aware that there are some existing arrangements where some of the employers have contracts with drug treatment services, for example, the Thunder Bay Counseling Services. So if the individual has drug problem that's affecting their performance and has a negative impact on their life, or then they can be referred to get their health more stabilized and to manage their drug and substance misuse problem.
So employer itself will refer to
Absolutely.
the treatment facility.
Absolutely. And the same can be said about the criminal justice system. They work collaboratively with the drug services, and they share the same objectives to help the individual manage their drug misuse problems to achieve recovery.
Okay. So the criminal justice system will refer them to the drug treatment center.
Absolutely.
Okay. Now, how can family and friends help in overcoming the drug addiction problem?
Well, it is a very difficult situation at times because a lot of the time people who struggle with drug addiction, they don't recognize the consequences of their behavior early on, and there can be an amount of resistance or denial about the drug misuse problem. So my advice to families and friends that if they identify any such concern about their loved ones suffering from drug problem, they could seek advice from their primary care provider or from drug treatment centers so that they can get a referral. But more importantly, they should speak to the individual and share with the individual their concerns
Right.
and discuss with them about best way to go beyond the addiction problem and how to manage it.
So if family is involved into treatment, there are more likely chances of getting it cured.
Absolutely, and many of the services, they would welcome involvement of friends and family, and they have the facilities not only to help the individual but also their loved ones.
Now, in the treatment of drug addiction, coexisting mental disorders, are there any other disorders, or psychiatric or psychological disorders, which can affect the drug addiction?
Certainly, it makes it more challenging and more demanding if both conditions coexist, and it's unfortunately one of the reasons why people turn to drugs to self-medicate and to manage their mental health problems. It can coexist with anxiety disorders, mood disorders like depression or bipolar illness, or psychotic disorders such as schizophrenia. Most of the time that requires specialist care, and it involves multidisciplinary team with the nurses, psychologists, psychiatrists working together to help the individual manage both conditions, because if it's not managed, people may be more likely to forget to take their treatment, they're more likely to suffer from relapse or to be admitted to hospital. So both conditions must be managed at the same time.
Right. So if there are multiple psychiatric conditions, they have to be diagnosed because they have an impact on the drug addiction also.
Absolutely. And same way like drug addiction can have a negative impact on the management of mental health
Now,
disorder.
does drug addiction also the treatment of drug addiction can also reduce the incidence of infectious diseases like HIV and AIDS or hepatitis C? So how does that affect?
There is this very strong link, and addressing drug addiction problems can lead to reduction in the rates of these infectious diseases, because if the individual is less likely to engage in dangerous or risky behavior, including unprotected sex or sharing of injection equipment, they are less likely to develop these conditions. Even if for people who suffer from any of these serious conditions, there is access to resources or information that help them manage these conditions and these illnesses while they are getting treatment for the addiction problem. And there are centers in Thunder Bay, such as the Thunder Bay District Health Center and Elevate organization. They provide the clients, their families, and or others involved in their care with information about and resources on how to manage these conditions. But it's a necessary step to reduce the rates of infection supported to address the drug addiction problem.
What are the chances that person going through all the treatment for the drug addiction, they will get cured completely? They'll come out of it?
Well, very high chance, and we're always optimistic about achieving recovery, and many people recover and they lead a very successful life afterwards.
Many people recover after drug addiction. Oh.
And I can give you examples about the services that exist in Thunder Bay. I've mentioned about the Thunder Bay Counseling Center. Individuals can refer themselves directly to them, and they go through a process of assessment, and they will be allocated a counselor, and they could be taking part in group activities or individual sessions. There's also the St. Joseph's Health Group Addiction and Mental Health Services. They manage broad spectrum of needs, mental health and addiction, and they have facilities to support people. Both organizations support people who are young, adult or senior citizens, and they work in collaboration. And I can give you an example about a partnership between both organizations. It's called U-Turn, and that's mainly to support adolescents who suffer from drug problem. So there are multiple partnerships and collaborative working that's going on in the city that people can get access to.
Now, children as well as adults, anybody can get affected, right? So,
absolutely.
And you have treatment options available for children as well as for the adults as well.
Certainly.
What is the best way to prevent the drug addiction?
Well, the best way to prevent drug addiction is more knowledge, more public awareness about the implications and the consequences of drug misuse. But also it's important that the public, especially those who are affected by drug problems, are aware about the services available to manage these conditions. And they should always be reassured that there's warm welcome They will not be judged. The door is open. They can go back as many times as necessary until they feel comfortable to get the treatment required to achieve recovery.
So drug addiction is a treatable problem, and more education and more awareness about this problem is the solution to get aware of.
Absolutely, that's the key.
This problem. Yeah. Thank you, Dr. Khalil. It was so much helpful for you to come here and guide us on the drug addiction problem.
Well,
thank you so much.
It's a pleasure. Thank you so much for inviting me.
Thank you, everyone, for joining the show.